Why should you urinate after sex for UTI prevention? Imagine a simple habit that can make a big difference in your urinary health. Many people wonder if there's a way to lower their chances of getting a urinary tract infection after intimacy. Well, the answer is yes, and it's surprisingly straightforward. Urinating after sex is widely recommended by health professionals as an effective way to help prevent urinary tract infections, especially for those with vaginas. So why does this work? During sexual activity, bacteria from the skin or around the anal area can be pushed toward the urethra, which is the tube that carries urine out of the body. In people with vaginas, the urethra is short and located close to the vagina and anus, making it easier for bacteria to reach the bladder. When bacteria enter the bladder, they can cause an infection, leading to symptoms like burning, urgency, and cloudy urine. Urinating after sex helps to flush out these bacteria before they have a chance to multiply and cause an infection. The act of urination mechanically washes bacteria away from the urethral opening. For best results, it's recommended to urinate within about 30 minutes after sexual activity. This quick action can significantly reduce the risk of bacteria traveling further up the urinary tract. People who have a history of recurrent urinary tract infections benefit the most from this practice, but it is generally safe for everyone. Even those who do not often get UTIs can find it helpful as a simple, low-cost preventive step. It's important to note that this advice is mainly relevant for penetrative sex, as bacteria are more likely to be introduced during intercourse. Non-penetrative activities usually pose a lower risk unless there is direct contact with the urethral opening. Maintaining bladder health involves more than just urinating after sex. Staying well hydrated helps flush bacteria regularly, and wiping from front to back after using the toilet prevents bacteria from spreading from the anus to the urethra. Avoiding scented soaps or harsh products in the genital area also helps protect the natural balance of bacteria that defend against infections. While urinating after sex is a helpful preventive measure, it does not guarantee that you will never get a urinary tract infection. If you experience symptoms like a burning sensation during urination, frequent urges to urinate, or cloudy urine, it's important to seek medical advice promptly. Untreated UTIs can sometimes lead to more serious infections, so early treatment is key. Regarding bladder health and bladder cancer, there is no direct evidence that urinating after sex prevents bladder cancer. The main risk factors for bladder cancer include smoking, exposure to certain chemicals, chronic bladder inflammation, and genetic factors. However, keeping your bladder healthy by preventing infections and avoiding chronic irritation can contribute to overall urinary tract well-being. In addition to urinating after sex, drinking plenty of water helps to flush bacteria from your urinary system. Good hygiene practices, like wiping from front to back and avoiding scented or harsh products, support your natural defenses. Remember, everyone's body is different, so it's best to consult your healthcare provider for personalized advice, especially if you have recurrent infections or other bladder health concerns. In summary, making a habit of urinating after sex is a simple, effective way to reduce the risk of urinary tract infections. It supports bladder health by helping to clear bacteria that might have entered during intimacy. While it's not a direct method to prevent bladder cancer, maintaining good bladder hygiene and preventing infections are important parts of overall urinary health. Always talk to your healthcare professional to find the best strategies for your individual needs.